I call you to move. It's all right. Order. Before we begin, can I remind members that they are expected to wear face coverings when they are not speaking in the debate, and this is in line with current government guidance and that of the House of Commons Commission. I will call Conor McGinn to move the motion, and then I will call the Minister to respond. There will not be an opportunity for the member in charge to wind up, as the convention is that for 30-minute debates. Order, order. Conor McGinn to move the motion.
Thank you, Ms Cummings. It's a pleasure to serve under your chairmanship, and I'm delighted to have secured this debate on Tourette Syndrome and how a lack of provision for research, diagnosis and treatment is impacting on individuals and families across the United Kingdom. So, firstly, I think it's worthwhile explaining what Tourette Syndrome is. In short, it's an inherited neurological condition which causes involuntary and uncontrollable motor and vocal tics. Tics usually start in childhood around the age of 6 or 7, and they can fluctuate in severity and frequency, potentially occurring in nearly any part of the body and in any muscle. This can be painful, as one might imagine, and of course very debilitating, even disabling. Tourette's is not often experienced in isolation. Up to 85% of those with Tourette syndrome will also experience co-occurring conditions and features which might include attention deficit hyperactivity disorder, ADHD, or obsessive compulsive disorder, OCD, and indeed anxiety. And these can be equally, if not in some cases, more challenging to manage than tics. By far, the biggest misconception about Tourette's is that it is a condition that simply makes people swear or say socially inappropriate things. Involuntary swearing is a symptom of Tourette syndrome, but it only affects a minority. 90% of people with Tourette's do not have this syndrome. But in my experience, having secured this debate, of speaking to colleagues in this place and others, that is the single common factor that those I have spoken to think is the defining characteristic of Tourette's, which I think goes to the heart of the challenge that we have around addressing some of the misconceptions about this condition. Because despite Tourette syndrome affecting the quality of life of over 300,000 people here in the UK, and approximately, figures indicate, one school-aged child in every 100, most of whom are undiagnosed, this is a condition which, though relatively prevalent, remains widely misunderstood. Indeed, it is often deeply stigmatised and mocked throughout society. Now, the stigma cannot be understated, and the impact of it is very real. A recent study published in the Journal of Developmental and Physical Disabilities in 2021 outlined just how much discrimination its participants faced in numerous aspects of life. 75% in education, 71% in their social lives, 61% on public transport, and 54% in employment. A 2017 study concluded that people with Tourette's are over four times more likely than the general population to take their own lives through suicide. Now, the reason I have applied for and am leading this debate today is in support of my constituent, Emma McNally, a St Helens mum, who first wrote to me in July 2020. Her son was diagnosed with Tourette syndrome aged 9 and could access regular appointments under the care of the excellent neurologist at Liverpool's Alderhay Hospital. I know it's familiar to the Minister. The retirement of the specialist in March 2020 left a gaping hole in provision locally, and Emma's son was discharged with no one able to take him on. And unacceptably, to this day, he has been left without the care that he needs. Now, Emma's journey from that local St Helens mum, who lives in Parr in my constituency, contacted her local MP to becoming a national campaigner and now the chief executive of the National Charity for Tourette's. It's done a great deal to highlight and raise awareness of the condition. Her e-petition on Tourette's through the mechanism we have here in this House secured 71,000 signatures. I think it reflected the clear strength of feeling there is across the country for better care and services. Now, she is fighting tenaciously on behalf of families around the country, and though our petition sadly fell just short of the threshold required for automatic discussion in this House. I'm glad we're having the debate today, and I think it goes some way to doing justice to her brilliant work and the importance of this issue. And I've been contacted by over 30 colleagues from all parties across the House, from all parts of the United Kingdom, to express their support. And I want to especially mention the Minister's colleague and the erstwhile Parliamentary Private Secretary at the Department, the Honourable Gentleman from St Austell and Newquay, who has worked with me over the last year on this, despite being prohibited from actively participating in this debate because he's now in the Government Whip's office. The debate is long overdue. The last time the House met to debate Tourette Syndrome was in 2010. Now, back then, Tourettes Action, the charity, held a list of 44 consultants in the UK with a special interest in Tourette Syndrome. Now, there are only 17 which provide care within the NHS and will see children. And there are none anywhere in the North West. Now, I'm sad to say that the picture for those living with this condition and their families has got worse over the last decade, and it should be getting better, and we need to change this, because families are telling me there is a significant and urgent need for specialist services and clinicians to bolster early diagnoses and treat people rapidly. Early intervention in Tourette's cases could reduce the more pernicious longer-term strains on an individual's mental and physical health and well-being, as well as on that of their friends, family, of course, colleagues, teachers of children, by not having a clear diagnosis or an idea of who to turn to. I will, of course.
Thank the honourable member for giving way and congratulate him on securing the debate. Just on the issue that he has explained about the much misunderstood aspects of Tourette's, would he agree with me that not only do we need more finance and more individuals, professionals involved in treating it, but that we also need to see a greater degree of research into what constitutes the development of Tourette's in order to try and assure present generations, future generations, that it can be seriously tackled?
And I want to thank the honourable member, well, my honourable friend, as he is from East Londonderry, for his support for the debate and his intervention, and I'll come to research, but it's an absolutely critical part of this in terms of a holistic approach that is understanding more about the condition, intervening early, and then providing that ongoing care. So I thank him for his intervention, his support for the debate, and for his constituents affected by Tourette's. It is unacceptable, and I'm sure the Minister will agree, that Emma McNally's son has to travel to London from St Helens to have treatment for this condition. And that is something that we need to change, because while it's true that specialist centres exist for Tourette's, the problem that families are finding is that many only accept local referrals or those from local children and adolescent mental health centres. If there's no Tourette's specialist present at a local CAMHS or indeed in the CCG, and the clinical commissioning groups consider this outside their remit, the result is that care is inevitably denied. Now, that produces a catch-22 situation where care isn't available locally at CCG level, nor further afield regionally, and only very sparingly nationally. Now, what families are saying is they want clearer referral pathways to help those with Tourette's, as well as clearer guidelines to give professionals the tools to do this, because despite their best efforts, many GPs simply don't know where to refer children or adults with tic disorders. Now, currently many are experiencing long waiting times and the ping-pong of being referred back and forth from one service to another, which, as well as being incredibly frustrating for patients, it wastes time and the resources of our professionals in the NHS, because even clinicians with CAMHS and paediatric specialities lack clarity on how to treat tics, and this is one of the things that fundamentally needs to improve. A clearer process with clear guidelines, along with increased professionals with a specialist interest in treating Tourette's, would also go some way to reduce the number of patients we see diagnosed and discharged at the same appointment, for whom follow-up care isn't any possibility, and they then find themselves trapped in this spiral of referral and rejection. Research, as the Honourable Gentleman has already alluded to, is key for clinical and public understanding. Now, in the government's response to Emma McNally's petition, it said that funding has been committed to support research into Tourette syndrome. Research investment into this condition through the National Institute for Health Research plummeted by almost 50% between 2019-20 and 2020-21, from just under 670,000 to just over 362,000. Funding has been committed to support research into Tourette syndrome. Now, the government also referenced a renewed focus on expanding Health Education England's clinical psychology training intake to help adopt and develop services and respond to patients' need. When I asked ministers what proportion of the wider clinical psychology intake had taken a specialist or indeed any interest in a Tourette's placement, the department said it did not process that information. Now, that won't provide much assurance to families listening today, and I wonder if the Minister, and I know she is sympathetic on this, and it's why I have deliberately made this about the issue and the policy, because I think it is one that we can work together on. But if she can provide some clarity on that now, or if that's not possible today, if she would take it away and perhaps write to me about it. Because this is a question of fairness. Tourette's has similar levels of prevalence in our society to autism and epilepsy, but where diagnosis and support for these conditions has improved in recent years, along with public awareness, understanding and support for Tourette's remains much more limited. Indeed, it's hard to imagine where many individuals and families would be without the fantastic work of charity and support groups in this area, like Tourette's Action, the Brain Charity, the ADHD Foundation, and others who do so much to support people. So, in conclusion, I hope today's debate will play a role in raising awareness of Tourette syndrome and the wider struggle so many families across the country face in getting the support and treatment they should be entitled to. The Minister has heard what I have had to say. Perhaps she may meet with Emma and some of the other families to hear directly from them if the opportunity arises. I know the Minister, I know her intentions are good, and I'm sure that she will pledge to do her bit to work with me and other members in this House who take an interest in this, as well as with the people directly affected, so that we can make sure and try and transform the experience of those living with Tourette syndrome so that they can get the support they need to live the happy and fulfilled lives that they very much deserve. Thank you, Ms Cumming.
The question is that this House has considered treatment and study of Tourette syndrome. Minister.
Thank you very much, Chair, and it is a real pleasure to serve under your chairmanship. And I would like to also begin by thanking the Honourable Gentleman, the MP for St Helens North, and our Honourable friend as well, for securing the debate on this important issue. And I very much have been listening and was hearing his impassioned case for better support for children and young people with Tourette syndrome. In particular, I was touched by the story of one of your constituents, of one of his constituents, Emma McNally, and hearing of the difficulties that she and her son face in accessing the care and support that he needs. And I would like to extend my personal thanks to Emma, whose tireless campaigning, along with other parents of children with Tourette's, has helped to emphasise the importance of children with Tourette's getting the help they need and the difficulties that they are facing getting that help, particularly in the northwest of England at the moment. And I know that for many patients and families, Tourette's can be an extremely debilitating condition to live with, and I regularly receive correspondence on this issue. I was particularly moved by the case of Jay Mangan from Sefton Central and his two children, Rebecca and Jack, both of whom have Tourette's. And having watched the video that Mr. Mangan shared, I was really struck by the severity of the tic episodes that both Rebecca and Jack routinely suffer from. And as the Honourable Gentleman flagged in his own speech, Tourette syndrome can be misunderstood, and there is not much awareness of it. So videos like this are really helpful, and it is important also that Mr. Mangan and families like Mr. Mangan's get the support that they need. Indeed, we know that with the right care and support, someone living with Tourette syndrome can lead a fulfilling life, which is why the government is determined to ensure all those with the condition have access to the appropriate services. Now, the majority of services are commissioned by the clinical commissioning groups, who are best placed to understand the needs of their local area. Services are commissioned through local community paediatric services or child and adolescent mental health services. And these services will be appropriate for the majority of children and young people with Tourette syndrome. And the teams involved will refer them to multidisciplinary teams, including clinical psychologists where necessary, to help with the management of their conditions. Clinicians are supported in this work through the British Medical Journal Best Practice Guidance on Tourette's, which covers both diagnosis and management. For those children and young people who require more specialist support, there are currently 3 recognised specialist centres in the UK, 1 located in Sheffield and 2 in London. And these centres have internationally recognised expertise in the assessment and management of Tourette's syndrome. Now, I understand that following the retirement of a consultant at Alderhay Children's Hospital, who had developed a special interest in Tourette's, there is not currently the same level of support available in the area that there was previously, and we heard the story of how that impacted Emma's son. Local CCGs have acknowledged this impact and the impact this is having on families and are considering options to address this. We understand that Alderhay Children's Hospital have developed a proposal for a local tertiary service for Tourette's, which is currently under review. Discussions with the 9 Cheshire and Merseyside CCGs is being led by the NHS Liverpool CCG, with a meeting planned for later this month to scrutinise the proposed clinical model. I've asked to personally be apprised of the situation, and I would like to take this opportunity to extend an invitation to the Honourable Gentleman to meet personally with myself to discuss this local situation further. And of course, I'd be very happy as well to meet the families and learn as much as I can from lived experience. To support patients across the country, it is vital that we have sufficient numbers of trained healthcare professionals, something the Honourable Gentleman mentioned in his speech. There are more doctors and consultants working in the specialism of neurology in NHS trusts and CCGs in September 21 than there were 12 months earlier. And furthermore, Health Education England has supported a 60% expansion in the clinical psychology training intake over the past 2 years. And this is expected to achieve a growth of 2,520 additional psychologists in the NHS workforce by 2025. And clinical psychologists are well placed to develop new services and undertake further bespoke development to respond to the needs of patients with Tourette syndrome. To support the provision of those services which can help children and young people with Tourette's, we are increasing funding to child and adolescent mental health services. In March 2021, we announced an additional £79 million of funding that will be used to significantly expand children's mental health services. This will allow around 22,500 more children and young people to access community health services and a faster increase in the coverage of mental health support teams in schools and colleges. The Department for Education have also announced more than £17 million to improve mental health and wellbeing in schools and colleges, including new funding to train thousands of senior mental health leads. But we also acknowledge support must be provided to unpaid carers of children and young people with Tourette's, whose lives are significantly impacted by the responsibility of providing around-the-clock care and support. We will invest up to £25 million to work with the sector to kickstart a change in the services provided to support unpaid carers. We know what vital role they play and the sacrifices that they make for their families. We expect that this funding will identify and test a range of new and existing interventions, which could include respite breaks and peer group and wellbeing support. Now, the Honourable Member for East Londonderry also mentioned research, and research is very important. We, as we look forward, recognise the value of funding and support research into Tourette's. We're currently funding a number of studies, including a study on deep brain stimulation in people with Tourette's syndrome and a digital behavioural intervention for tics in children and adolescents. And the Honourable Gentleman mentioned the change in funding, the variability in funding. There's been £2.1 million spent between 2018 and 2020 on Tourette's research, but it does depend on applications to the fund, which is not always linear. But we very much do welcome applications to this fund and look at, to look at Tourette's and to make sure that we understand the underlying conditions in addition to these these studies that we're doing. I would like to close by once again thanking the Honourable Member for bringing up this debate. It is important. It will be important to the families. It will be important to raise awareness, and it will be important to the families in the Northwest, in the Merseyside area, an area, as he said, I'm familiar with. I'm from myself, and it is important that they get the support they need. Because it is very difficult to overcome for some families. So for all the work done by parents and families, I thank them as well for raising the profile, and mostly that understanding that with the right care and support, people can go on to live fulfilling and happy lives. I look forward to meeting with him and to meeting with some of the campaigners to discuss the issue further and to focus on getting the support needed for the many families in the Northwest. Thank you.
The question is that this House has considered treatment and study of Tourette syndrome, and as many as are of that opinion say aye. To the contrary, no. I think the ayes have it. The ayes have it. Order, order. The sitting is suspended until 2:30.
The proceeding has ended. 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 The proceeding has ended.